Hello everyone. A very good morning to all of you. A very good morning to all of you. Am I visible? Am I audible? Am I live? Let me confirm. If I'm clearly visible, audible, I will start the lecture in a minute. I hope it's working. Yeah, I hope it's working. A very good morning. I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today I'm here to continue my series that is image-based question. So daily I will teach you image-based question from the pathology. As we know that nowadays in all competitive exams, whatever competitive exams you are talking about, we have around 25 to 30% questions are IBQs, image-based question. And pathology is a vital subject from which many image-based question can be created from general pathology, from hematology, as well as from systemic pathology. So that's why I have started a series that is IBQ series in pathology, in which daily for 1 hour, I will teach you only IBQs from the pathology. Topic by topic. So we have started, I guess, hematology yesterday. In hematology, we have started RBC disorders yesterday. In RBC disorders, in hematology, we have yet started RBC disorders yesterday only. Hope you have watched my yesterday's lecture, either live or recorded. In RBC till now, we have done inclusion bodies. All the inclusion bodies are covered in the RBC, various image-based question based on them. Then we have covered various shapes of the RBC. So image-based question based on the shapes are also covered. And now I'm starting with anemias, image-based question of anemias. After completing RBCs, I will come on WBCs and platelet tomorrow. That is lymphoma, leukemia, other image-based question on WBC and platelets tomorrow. So today I'm starting with anemia. Give me a thumbs up. Should I start with anemia? Am I visible? Am I audible? Are you guys there? Can we go ahead with the image-based questions of anemia? Yes? Yes, I guess we can go ahead with the anemias. So here is the first question in front of you. Let me read the question. Let me show you the image. What thing is given in the image, what finding, specific finding given in the image, based on that you give what is your correct answer, right? So see, age is always important. A 45-year-old person presents with the complaint of paresthesia. What do you mean by paresthesia? So by paresthesia, we mean a complete numbness in the nerves. So the person is having problems in the nerves, some paresthesia, tingling sensation, numbness in the nerves. So sensory nerves में some problem है, and peripheral smear is given to you. In the peripheral smear, what finding you can see? What finding in the peripheral smear? You can see a neutrophil. You can see a neutrophil, okay, and you can see many RBCs. See all these RBCs. For comparing the size of RBCs, you always require a lymphocyte. So lymphocyte is just given to compare the size of the RBC to decide whether the anemia is normocytic, microcytic or macrocytic. We have to compare the size of RBC. Here all RBC size we have to compare with the lymphocyte. If RBC are same size, they are normocytic. If they are smaller, they are microcytic, and if they are larger, they are macrocytic. So three types of RBCs are there based on their size, whether their size is same, small or larger as compared to lymphocyte. So the lymphocyte is always given in the image. But the relevance of giving a lymphocyte in the image is to compare the size of RBC with the lymphocyte. That is the point you should always know, right? But a neutrophil is given to you. So some abnormality in the neutrophil is there. So what is the abnormality in the neutrophil and what is the abnormality in these RBCs? And one clue in the question. There is a clue in the question that there is a problem in the nerves. Nerves में भी कुछ problem है. The patient is presenting with paresthesia. Based on these findings, the image and the clinical complaints. What is your diagnosis? So most of the students are saying B as correct answer. Very good, very good. So all of you are right. B is the correct answer. The diagnosis is megaloblastic or macrocytic anemia. Now all those who have answered B. One more question I want to ask you here. All those who have answered. So Mosh, Dr. Priyanka, Shivam, Dipti, Shikha, Sunita, everyone, those who have answered it correctly. Everyone. I can't read all names. But yeah, everyone. One more question for you. We all know that macrocytic or megaloblastic anemia can occur by deficiency of vitamin B12 or can occur by deficiency of folic acid. So my question to you, what is the specific deficiency in this question? Yeah, I agree it is macrocytic megaloblastic anemia. But whether it is vitamin B12 deficiency or folic acid deficiency, can you comment that? Can you comment that? Can you write your answer? मेगालोब्लास्टिक तो है, वो तो समझ में आया, लेकिन विटामिन B12 की डेफिशिएंसी से है कि फॉलिक एसिड की डेफिशिएंसी से है? The information given in the question, is it sufficient to decide? So most of the students are saying vitamin B12. Someone is saying Armold is saying folic acid also. Now those who are saying vitamin B12, why? My question to you, why? You are right. It is vitamin B12 deficiency in this question, not folic acid. Not folic acid. My question to you, why? Why? Does anyone know the answer? Based on the ऐसा क्या है इस question में? Which specific? Now based on the image I can't say. If you give me only image, I can't say whether it is vitamin B12 or whether it is folic acid. Image is same for both of them. But the clue given in the question, that is paresthesia. Paresthesia only occurs in vitamin B12 deficiency, not in folic acid. If paresthesia is given in the question, it has to vitamin B12 deficiency, not folic acid. But if you don't give paresthesia in the question and only image is given to me, I can't comment whether it is vitamin B12 deficiency or folic acid deficiency. You got my point? You got my point? Yes or no? Should I proceed? Should I proceed ahead? Give me a thumbs up. Give me a thumbs up. So I'm coming on that. I'm coming. Now let me give the complete explanation. What is megaloblastic anemia? Now what are the findings? Two findings given in this image. Can you see a neutrophil? Now count the lobes in the neutrophil. Lobe number 1, lobe number 2, lobe number 3, 4, 5, 6, 7. I can see 7 lobes in this neutrophil. So basically this neutrophil is not a normal neutrophil. It is a hyper-segmented neutrophil. Hyper-segmented neutrophil. What is the definition? What is the normal lobes in a neutrophil? Normal neutrophil have 2 to 5 lobes. More than 2 and less than 5. Between 2 to 5, normal neutrophil have lobes. Any neutrophil having lobes more than 5 is known as hyper-segmented neutrophil, and it is an abnormal neutrophil. This neutrophil is seen in megaloblastic anemia. That is the first thing. Now all the RBCs here, grossly if I see, these RBCs are larger than this lymphocyte. That is, the RBCs are megalocytes. These are bigger, macrocytes. The RBCs are bigger. So two findings in the image. Number 1, neutrophil is hypersegmented, and number 2, the RBCs are macrocyte. Based on these findings, my answer is megaloblastic anemia, and based on paresthesia, my answer is vitamin B12 deficiency. Let me explain you why paresthesia occurs in vitamin B12 deficiency. Yes, the answer is B. You people are there? Should I explain? So two findings in the image and 1 in the question. Total 3 findings ke basis pe my answer is. Now please listen, I'm telling you again. So first finding in the image is hypersegmented neutrophil. In this neutrophil, total 7 lobes are there. Second finding in the image, the RBCs, the size of these RBCs is larger than lymphocyte. That is, RBCs are macrocytes. These are bigger. These are macrocytes. So these are the 2 findings in the image, along with the finding. Now on the basis of these 2 findings, I can say it is macrocytic anemia. But macrocytic anemia is vitamin B12 ki folic acid. Which deficiency? So for this, I cannot comment based on image. Image दोनों का same होगा. Vitamin B12 deficiency, same image. Folic acid deficiency, same image. But based on the clinical complaint, paresthesia occurs in vitamin B12 deficiency, not in folic acid. So my final answer, it is macrocytic anemia, megaloblastic anemia due to vitamin B12 deficiency, not folic acid. This is my final answer. Now let me explain. Let me explain. Now, can anyone of you tell me one thing, that vitamin B12 and folic acid deficiency, how does they lead to anemia? How does? What is the mechanism? Why? If someone is having, just suppose I'm having vitamin B12 deficiency, or I'm having folic acid deficiency. Folic acid is present in green leafy vegetables. I don't eat green leafy vegetables. Vitamin B12 is present either in non-vegetarian, that is meat, or it is present in dairy. But I'm a pure vegan. I don't eat meat. I don't take dairy products. I don't take milk. If suppose, right? So I'm having vitamin B12 deficiency. I'm having folic acid deficiency. So why I will have anemia? Why? What is the pathogenesis? Why these 2 things are required? Yes. So Moksh is absolutely right. Because these 2 things are required for the formation of DNA. Which step of DNA? Moksh. DNA में क्या? What thing? Which step of DNA formation they are required? We know DNA is made up of 4 things. What are the 4 things? Adenine, guanine, cytosine and thymidine. How does this thymidine is formed? Have you ever thought thymidine कैसे बनता है? Thymidine is formed from uracil. So uracil get converted into thymidine. For this conversion, you require folic acid. For this conversion, we require folic acid and B12 also. So these two things are required for the formation of thymidine. Now imagine a situation if B12 or folic acid are deficient. Either of them or both of them are deficient. So uracil will not convert into thymidine. So thymidine will not form. So DNA will not form. So basically DNA nahi banega. So you will say, ma'am, DNA is present in all cells, not only in RBC. So I say yes, patient will have anemia also, but patient will have problem in WBC and platelet also. So patient have problem in all cells in megaloblastic anemia. Megaloblastic anemia is something, it is not only anemia. Patient have problem with DNA synthesis, and DNA is present not only in RBC precursors, but present in other cells also. The second question you should ask me, ma'am, RBCs RBCs are non-nucleated cell. They don't have nucleus. We know that. We know that. RBC के अंदर तो nucleus होता ही नहीं है ना. So why DNA is required? If DNA synthesis do not take place, what is the problem to the RBC? RBC के पास तो nucleus ही नहीं है. But the precursor of RBC, RBC बना किस में से है? From which cell RBC is formed? RBC is formed from the normoblast. Early normoblast, intermediate normoblast, late normoblast. Finally got converted into reticulocyte and they got converted into RBC. They have nucleus. So if DNA, so let me come on the slide, right? So the problem is with the DNA synthesis. See this step. Can you see UMP got converted into TMP? That is uracil monophosphate get converted into thymidine monophosphate. And for this step, we require folic acid, tetrahydrofolic acid, and we require B12 also. So if folic acid and B12 are absent, uracil will not get converted into thymidine and DNA will not form. Give me a thumbs up. No DNA form. So DNA will not form. So nucleus will not form. Nucleus of the cell will not form. Can you see this is the steps in RBC formation I am talking about. So the first cell is pro-erythroblast, then early normoblast, intermediate normoblast, late normoblast. This is early, intermediate, late. This is reticulocyte. And finally RBCs are formed. Now this is nucleus, this is nucleus, this is nucleus, this is nucleus, but now nucleus are absent. Nucleus is extruded out at late normoblast stage. After that, we don't have nucleus. We don't have nucleus in our reticulocyte. We don't have nucleus in RBC. But if DNA cannot be formed because thymidine is absent, because vitamin B12 or folic acid are absent, so thymidine is absent. So DNA is absent. So nucleus is not forming. So what is happening now? Listen my thing. Listen my point. It is very difficult to understand. So cytoplasm contains hemoglobin. There is no problem in the hemoglobin. So cytoplasm is going from one stage to the next stage. So pro-normoblast cytoplasm got converted into early, early got converted into intermediate, intermediate got converted into late. So cytoplasm is going ahead, but nucleus got stuck. Nucleus got stuck at this stage only. Nucleus cannot mature. Nucleus cannot mature because DNA is absent. DNA cannot be synthesized. So what is happening? Normally both takes place synchronously. So cytoplasm also go to the next stage and nucleus also go to the next stage simultaneously, normally. So from pro-normoblast, they got converted to early. Both got converted to early. From early, both got converted to intermediate. From intermediate, both. But here it is not the case. Here cytoplasm is going ahead, but nucleus is lagging behind. So what is my point? Maturation of nucleus lag behind the cytoplasm. Please take this point. So this is known as nucleus cytoplasmic asynchronicity. This is known as nucleus cytoplasmic asynchronicity. In sub points where you have MCQs, you should understand. So nucleus cytoplasmic asynchronicity में which is going ahead. So asynchronicity मतलब एक आगे है एक पीछे. One is ahead, one is lagging. So who is ahead and who is lagging? So cytoplasm is ahead. वो आगे भाग गया. And nucleus is lagging behind. Nucleus पीछे रह गया. So there is asynchronicity, right? And this leads to, because cytoplasm is going ahead, so cell is becoming bigger. That's why the RBCs which are formed are macrocytes. They are macrocytes. They don't have problem in the cytoplasm. So cytoplasm is too much. So they are big in size, but the nucleus is defective. They don't have nucleus, but their precursor nucleus is defective. Give me a thumbs up. Everyone give me a thumbs up. Give me a thumbs up. So Sunita is asking in which stage hemoglobin is formed. Listen on this thing. Sunita, two questions are important. It is a good question you have asked. The first thing, hemoglobin. Now, Sunita, you only tell me, see the cytoplasm color. Let me show you. See the cytoplasm color of all these precursors. See, this is pro-normoblast. This is early normoblast, intermediate normoblast, late normoblast, reticulocyte, and RBC. Sunita, you only tell me, see the color of the cytoplasm. The color of the cytoplasm is changing from blue to pink at which point? See, it is blue cytoplasm. It is blue, but this one is pink. This one is pink. Pink is due to hemoglobin. So hemoglobin first time appears at intermediate normoblast stage. So you yourself got your answer, I guess, right? Now the second question, nucleus is extruded out at which stage? So this is having nucleus, this is having nucleus, this is having nucleus, this is having nucleus. But after this, we don't have nucleus. So nucleus is extruded out at late normoblast stage. So these are two very important questions which are asked from erythropoiesis. What are the two important questions? Hemoglobin first time appears at intermediate normoblast and nucleus is extruded out. Nucleus extruded out of the cell at late normoblast. Everyone give me a thumbs up. You got these 2 points, 2 MCQs. Now learn the other name of early, intermediate, late. Other name of early normoblast is basophilic normoblast. Intermediate is polychromatic and late is orthochromatic. How you will learn? There is a mnemonic. Mnemonic is BPO. BPO. You know BPO, early, intermediate, late. Basophilic, polychromatic, orthochromatic. No, you will never forget, I guess. So everything is very easy if you got the concept. Now, so that is all about megaloblastic anemia. You got my point? Give me a thumbs up. So what is basically happening in megaloblastic anemia? In megaloblastic anemia, maturation of nucleus is lagging behind the maturation of cytoplasm. So the cytoplasm is going to the next stage from early to intermediate, intermediate to late. It is going ahead. वो भगता जा रहा है, लेकिन nucleus उसको catch ही नहीं कर पा रहा, because DNA synthesis cannot take place. Why? Because vitamin B12 and folic acid are absent. So thymidine cannot be formed. So DNA cannot be matured. It cannot be synthesized. Give me a thumbs up, everyone. I want thumbs up from everyone. Each and every of you. Each and every of you. So what Moksh is saying, but ma'am, at pro-erythroblast, hemoglobin seen. Okay, I got it. I got it. At electron microscopy, Moksh, you are absolutely right. In electron microscopy, if you say the pro-erythroblast will be seen at pro-erythroblast stage in electron microscopy, but in light microscopy, the answer is early. So you have to be specific. In your exam, Moksh, what the question is coming? Hemoglobin first time appears at which stage? Simply, this is the question. So consider light microscopy only. So see the option, go with intermediate normoblast. But specifically, if the examiner is asking hemoglobin seen in electron microscopy at which stage? So go with pronormoblast. So that is my answer to you, right? So read your question very carefully. If it is simply asked, I will consider light microscopy if nothing is said. But if the examiner want to ask me specifically at electron microscopy stage, at electron microscopy, I agree, hemoglobin is present here only, but it is not visible. It is not giving color to the cytoplasm. It is very small amount. It is not giving any color. Later on, it will increase in quantity. So it will change the color from blue to pink. That is my answer to you, Moksh. Have you got it? So should we proceed ahead? One more point. In the question, now this is taking place in both deficiency, whether the patient is having B12 or whether the patient is having folic acid deficiency. So nucleus cannot be formed because DNA, because both are required for DNA. DNA cannot be formed, so nucleus cannot be formed. So this is the feature with both. But there is one more role of vitamin B12, which is not a role of folic acid. What? Vitamin B12 is also required for one more thing, not folic acid. DNA के लिए both are required, but vitamin B12 is also required for myelin synthesis of the axon. We have neurons in our body, brain have neurons. So this is the diagram of a neuron. Neuron have a cell body and neuron have an axon. There are dendrites. These are the dendrites. On the axon, we have a myelin sheath. You know, we have a myelin sheath. This myelin sheath synthesis, for this myelin sheath synthesis, we require vitamin B12. We require vitamin B12. I will tell you the exact step. We require. So if vitamin B12 is absent, so myelin sheath will not be formed. So the neuron will be abnormal. So patient presents with parasthesia. Patient will have parasthesia also along with anemia. So what is my summary? Which specific step? See, this is. So vitamin B12 is required for conversion of methyl malonyl CoA to succinyl CoA in the formation of lipids, that is myelin sheath. So methyl malonyl CoA cannot be formed, converted into succinyl CoA. So myelin sheath cannot be formed. So vitamin B12 deficiency also lead to neurological disorders along with anemia. Have you got it? So what is my summary? What is my summary? If one patient is coming to you with vitamin B12 deficiency, one patient is coming to you with folic acid deficiency, both of them will have megaloblastic anemia. Both of them will have megaloblastic anemia because DNA synthesis cannot take place in both of them, because vitamin B12 and folic acid both are required for DNA. But vitamin B12 is also required for myelin sheath synthesis. So here the patient also present with neurological disorders, neurological problems, right? Like paresthesia, tingling sensation, numbness, all these. Everyone give me a thumbs up. But folic acid deficiency results only in megaloblastic anemia, nothing else. Everyone give me a thumbs up. So how does the red cells look like? RBCs look like? RBCs are bigger in size. They are macrocytes, macroovulocytes, right? There is basophilic stippling, Cabot ring, and Howell jolly body. I guess you all know. Yesterday I taught you these three things in inclusion bodies of the RBC. So can you see, this is a RBC. This is a normal RBC. See the size. This is a RBC in megaloblastic anemia. See the size. It is bigger in size. So RBC is bigger in size. Now see, this is a peripheral smear of a megaloblastic anemia. Can you see in the now you will say, ma'am, nucleus is present in all cells. Now nucleus is present not only in RBC. You are saying nucleus is present in RBC also, nucleus is present in WBC also, and nucleus is present in platelet also. You are saying vitamin B12 and folic acid are deficient. So DNA cannot be formed. So nucleus cannot be formed. So all these cells should be defective. In the RBC, patient will have megaloblastic anemia because of the defect in nucleus. In WBC, patient will have hypersegmented neutrophils because of the defect in nucleus. Here the neutrophils will become hypersegmented because the DNA is defective. It cannot mature. So the nucleus of the neutrophil will become hypersegmented and platelet will become giant or bizarre. Platelet will become giant. So patient have problem with all three cell lines in megaloblastic anemia. Everyone give me a thumbs up. So here in this peripheral smear, now the final summary. In a megaloblastic anemia, you will find, पहले RBC की बात कर लो. See all these RBCs. All these RBCs are bigger. They are bigger in size. They are bigger. So these are macrocytes. Number one. Number one. Number second, see this neutrophil. It is hypersegmented neutrophil. Right, it is high. Count the lobes. 1, 2, 3, 4, 5, 6. I'm having 6 lobes. So more than 5 lobes, it is hypersegmented. Right. Number 3. Can you see this RBC? Inside this RBC, can you appreciate this dot? It is Howell Jolly body. It is Howell Jolly body is the nuclear remnant. Right. You know, yesterday I taught you. Can you see this one? Basophilic stippling. This is basophilic stippling. And can you see inside this RBC a ring of 8? It is cabot ring. So the 5 features which define a peripheral smear of megaloblastic anemia. 1, 2, 3, 4, 5. Number 1 RBC में है. RBC में what you will see? Macrocytes. The size of the RBC is more. Number 1. Number 2 WBC में. WBC के neutrophil में. Only neutrophil. It is hypersegmented. It is hypersegmented. Number 3, 4, 5 again RBC के inclusion bodies हैं. RBC के अंदर 3 inclusion bodies. What are the 3 inclusion bodies? You will find cabot ring, you will find basophilic stippling, and you will find one more. What was that? Howell Jolly body. Everyone give me a thumbs up. So these 5 things define a megaloblastic anemia. Everyone. Yes, Satish. Before reticulocyte, the nucleus will be expelled. Before where the nucleus expels out of the cell. It is out of the cell. Just out of the cell, it get degenerated. And there is no nucleus in the last 2 things. Reticulocyte and RBC don't have nucleus. Both of them are non-nucleated. Nucleus get expelled out of the cell and it got degenerated. Everyone give me a thumbs up. So you can see a lymphocyte and compare the size of the RBC with this lymphocyte. So of course the RBCs are bigger. See, this is the RBC, this is the lymphocyte. Compare the size. RBC is bigger, right? See, this is basophilic stippling. You can see the basophilic stippling. See, this is cabot ring, a ring of 8 inside the RBC. It is cabot ring, right? So that is the thing. I guess I have given you the answer. Any neutrophil having more than 5 lobes is known as hypersegmented neutrophil. Can you see? So this is the final answer. Can you see? Normal. This is normal. This is megaloblastic anemia. Everyone see. Here RBC ka size dekho. Here RBC ka size dekho. Compare the RBC ka size. Here neutrophil may count the lobes normally, and here neutrophil may count the lobes. Count the lobes here. Compare the neutrophil. Compare the RBC. Compare the neutrophil. You yourself will get your answer. Right. So that is the thing. So this image can also come in your exam. This image. So you can count 1, 2, 3, 4, 5, 6. Count the lobes. Count the lobes. Count lobes. How many lobes you can see here? How many? 1, 2, 3, 4, 5, 6. Anything more than 5. Right. So coming to the next question. Everyone give me a thumbs up. Jitne audience utni thumbs up. Should we proceed to the next question? The next question is already in front of you. I guess you should read it. And we will discuss this question also. Right. Spot the diagnosis. Very simple question. Spot the diagnosis. So 2 things are given. One is peripheral smear and one is the image of the face, the facial bones, the facial image of a child is given to you. So both are giving some clue. Combine the clues and tell me what is the answer. Is it iron deficiency anemia? Is it thalassemia? Is it acute leukemia? Is it Hodgkin's lymphoma? So in the image, just a second. In the image, you can see all the RBCs. Maximum RBCs have target cell. There is a dot-like structure in the RBC, right at the center. So maximum RBCs have target cells are there. Number 1 clue given in the image. The second clue given in the image. Many RBCs are nucleated. So these are premature RBCs. The precursors of the RBCs are coming. These are RBCs are non-nucleated, but some of the RBCs are showing nucleus. Come on. How RBC can show a nucleus? These are nucleated RBCs. Nucleated RBCs means these are premature. These are the precursors of the RBCs which leave the bone marrow and coming in the blood very fast. So before maturing, they are coming in the blood. So these 2 findings are given in the peripheral smear. Number one. Along with it, anisocytosis, poikilocytosis, everything is given. Now see the image of the patient. In the image of the patient, can you see these cheekbones? the cheekbones and this bone, the jawbone, that is maxilla. This is our maxilla. This is the mandible. Upper jaw is maxilla and lower jaw is mandible. I am talking about upper jaw. Upper jaw, the maxilla and the jawbone, it got expanded. Can you see this portion, the cheekbone and the upper jaw, it is expanded. It is expanded in this child, right? So the typical diagnosis, the answer, you all are right. It is thalassemia. It is I will give you the explanation of both. Why peripheral smear have target cell, why peripheral smear have nucleated RBC, and why in the face the cheekbones got expanded. So it gives a diagnosis of thalassemia, and most of you are right. Okay. Let me tell you, the answer here is of course thalassemia. Answer is of course. Now, why the person in the image is having prominent cheekbones, right? Can you see? Okay. So let me draw where the RBCs are formed. Of course, the RBCs are formed in bone marrow. Which bone marrow? So this is hematopoietic stem cell. Hematopoietic stem cell got converted into pro-normoblast, early, intermediate, late normoblast, reticulocyte, and finally RBCs are formed, right? And this is the blood vessel of any normal person. And finally, these RBCs, once they are formed, after becoming mature, they come in the blood. The precursors do not come in the blood. Only 2 to 3% of the retic come in the blood normally. So if you check my blood, I'm having RBCs and few retic, but I don't have pro-normoblast, early, intermediate, and late in my blood. I'm having these cells in my bone marrow, but I'm do not having the precursors in my blood. I do not have. Normal person don't have. Precursors don't come in the blood. The final mature product come in the blood. That is a thing we all know. I guess we all know, right? Now, what is the problem here in thalassemia? What is the problem? Thalassemia mein basic problem kya hai? Thalassemia. Thalassemia. What is the problem? Now, let me draw these cells. These are the precursors. All these precursors have nucleus. Hematopoietic stem cell, pro-normoblast, early, intermediate. Till intermediate, we have the nucleus. Nucleus is extruded at late, right? Till now, we have nucleus. Inside the nucleus, we have chromosomes. Inside the chromosomes, we have gene, right? So there is a gene for globin. There is a gene for globin. No, hemoglobin. Write the word hemoglobin is made up of two things, heme and globin. Heme is made up of iron. Iron is required for forming heme. But globin is a protein. It is formed by a gene. Globin के लिए genes हैं. Genes के transcription और translation से globin बनता है. All genes do transcription and translation and form proteins. We know. Genes express themselves by forming protein. So there is a gene for globin. Two type of globin are there. 2 alpha, 2 beta, total 4 globins are there in one hemoglobin. So we have a gene for alpha globin. We have a gene for beta globin inside the nucleus of these cells. Now I'm talking about the nucleus of all these cells. So inside the nucleus, inside the chromosome, the genes are mutated. Either the alpha globin genes or the beta globin genes are mutated, whatever. So either the patient cannot synthesize alpha globin or the patient cannot synthesize beta globin. Ultimately, patient cannot synthesize globin. So globin नहीं बनेगा तो hemoglobin नहीं बनेगा. Since hemoglobin नहीं बनेगा तो hemoglobin will fall and patient will have anemia. So that is thalassemia. In thalassemia, patient have problem with the globin, not with heme. Patient have problem with globin. Globin में what is the problem? What is the problem? Globin is less, either absent or less. Either it is absent, it cannot be synthesized, or if it is synthesizing, it is in less quantity because of mutation in the gene of the globin. So it is a quantity कम है, quantitative defect. Give me a thumbs up. It is not qualitative. Whatever forming, if it is less, whatever जितना बन रहा है वो normal है, लेकिन कम बन रहा है, या तो absent है या कम बन रहा है. So quantitative defect है, right? Quality में कोई problem नहीं है. राइट, सिकल सेल एनीमिया में भी ग्लोबिन में प्रॉब्लम होगी, बट वहां पे जो बनेगा वो कम नहीं बनेगा, वहां पे क्वालिटी अच्छी नहीं बनेगी ग्लोबिन की. डिफेक्टिव ग्लोबिन विल बी फॉर्म्ड. हियर ग्लोबिन इज नॉर्मल बट इट इज लेस, आइदर एब्सेंट और लेस. सो क्वांटिटी, क्वालिटी आर द टू टर्म्स. So I am saying there are two types of defect in the globin: qualitative defect and quantitative. Quantitative defect is thalassemia and qualitative defect is sickle cell anemia. Both are globin defect, not heme. Heme में defect is iron deficiency anemia. Give me a thumbs up. I'm trying my best. Everyone give me a thumbs up. Everyone, right? So yeah, Sundu, extramedullary hematopoiesis will definitely take place in these patients, but I'm not interested in teaching you that. I'm interested in teaching you the pathogenesis of the thalassemia. So here in thalassemia, this is the problem. So what will happen, since the RBCs are less, since the hemoglobin is less, inside them the globin is less, so hemoglobin is less, so RBCs have less hemoglobin and they will come in the blood. So all to compensate, hemoglobin is less in the blood now. To compensate that, all the precursors will come in the blood. So these are nucleated RBCs. These are nucleated. That's why in the peripheral smear we can see nucleated RBCs. Nucleated RBCs. Now, to compensate, what will happen? The bone marrow will expand. This bone will expand the marrow so that we can synthesize more RBCs. So bone marrow got expand. What I am saying? Bone marrow got expanded to compensate the thalassemia. The thalassemia, bone marrow got widened, right? So can you see the cheekbones? That's why here all the bones where hematopoiesis, erythropoiesis takes place, it got expanded. So erythropoiesis takes place in the skull bone. Can you see skull bone? So can you see this is normal skull bone? It got expanded here. Can you see it is expanded? It is expanded. Skull bone is expanded. Can you see it is expanded here? Appreciate the expansion. So it is expanded. Expanded skull bone. This can also come image based question in your exam the next year, this year. Give me a thumbs up. So can you see it is the space in the skull bone which got expanded to compensate for the thalassemia, for the RBCs, whatever hemoglobin is lost, to compensate. The cheekbones got expanded. The cheekbones got expanded. The jawbone got expanded. The skull bone got expanded. That's why these child have a typical facial expression. Typical faces, faces henke. Because the skull is expanded, the jaw bones are expanded. Because bone marrow is expanding to compensate. That's why they have typical faces. So just suppose like any this child entering in your clinic with their parents, looking at the first sight, you should identify this is a thalassemic child. Looking at the face only, you should identify. After that, so you will always have a suspicion this child may be thalassemic based on the facial expression. The cheekbones are expanded, jaw is expanded, skull is expanded. So you may have, and after that you will, of course, you will do the investigations. Based on that, you will give your final diagnosis. The final investigation based on which we can give the diagnosis is hemoglobin electrophoresis. Everyone give me a thumbs up. Everyone. So that is about the thalassemia. So look at the question again. Now, can you see this child? See this one, this one, this one, and along with the peripheral smear. In the peripheral smear, please appreciate the nucleated RBCs. Why anyone will have nucleated RBC in the blood? RBC don't have nucleus, but this child have nucleated RBC. So the precursors are coming in the blood, leaving the bone marrow to compensate. So this is a compensatory activity and the bones are expanded. So this is also compensatory activity. So the answer is thalassemia. Everyone give me a thumbs up. Everyone means everyone. You got my point? So let me proceed to the next question. This is the next question in front of you. Everyone. Please read the next question and tell me what is the answer. Coming to the next anemia. So till now we have done two questions. One is on megaloblastic anemia with details. Second is on thalassemia with details. I am coming on the third question. So the third question is in front of you. Let me read the question for you. A 6-year-old boy presents with acute abdominal pain and non-healing ulcer on the medial malleolus. So two problems, acute abdominal pain and non-healing ulcer. You have done a peripheral smear. This is the peripheral smear. Why this child is having acute abdominal pain and ulcer on the skin? Two things are happening in this child, and this is the peripheral smear. What you can see in the peripheral smear? Two findings in the peripheral smear. Two findings. Okay, let me mark those who cannot identify. So can you see this is the shape of this RBC? Some RBCs, this RBC and this one. See these three or these four RBCs. See the shape. And the remaining RBCs, they again have target cells. They have a dot-like structure. Many of them have. So these are the two findings. So typical is the sickle shape. Even a single RBC, you will say, ma'am, chari to hai. Even a single, I'm saying even a single RBC sickle shape, it is the diagnosis. It is enough for diagnosing sickle cell anemia. So it is a typical case of sickle cell anemia. So target cells are there. I got it, but that is non-specific. We have seen target cell in thalassemia also. So they are contributing in the diagnosis, but they are not very specific for single anemia. They are seen in many anemia. They are seen in iron deficiency anemia, thalassemia, sickle cell anemia. In many anemia, we get targeted cells. Give me a thumbs up. But something specific in this image is sickle cell. There are many IBQs for sickle cell anemia. So see all the RBCs. Your eyes should be vigilant. That looking at the image, you should, even agar ek bhi sickle cell given hai image mein, you can pick it up. That even one RBC is sickle shape, the diagnosis is sickle cell anemia. No, the answer is very easy. What is the pathogenesis I am asking? Why sickle cell anemia occurs? Why? Why RBC instead of biconcave, they become sickle shaped? Why? Why this transit occur? Is it nucleotide repeat? Is it antibody to RBC membrane? Is it substitution of a single amino acid base? Or is it genomic imprinting? What is the problem? What is the problem? Most of the students are right and I am happy. Of course, the correct answer here is C. So for those who didn't got it, let me give the detail, a little bit detail of sickle cell anemia. What is actually happening? The answer is sickle cell anemia. So those who have given the answer C, you all are right. Can you specifically tell me which amino acid is replaced by which one? कौन सा किससे replace हुआ? Tell me the name of the amino acid. Exact amino acid. Name the amino acid which is replaced by the other one. So you should be very specific in your answer. Listen. Okay, I will tell you everything. As I have told you that there is a gene for beta globin on chromosome number 11. On chromosome number 11, we have a gene for beta globin. On the sixth codon of this gene, we have a mutation in which valine is replaced by glutamic acid. Because of this change, valine is replaced by, okay, this is, okay, let me start from the beginning. Can you see this is a hemoglobin? Of course. In hemoglobin, this is a normal diagram of a hemoglobin. The four red things are four heme. We have four heme and we have four globin. Out of the four globin, we have two alpha and two beta. Can you see the two pink one are the alpha, the two yellow one are the beta. So in a hemoglobin, we have one molecule of hemoglobin. We have four heme and we have four globin in one molecule. Out of the four globin, two are alpha, two are beta, right? This is synthesized from the iron. For heme, we do not require any gene. It is synthesized from iron. But for globin, we require genes. These are the proteins which are formed from genes by transcription and translation. So separate gene for alpha, separate gene for beta. Gene for beta is present on chromosome number 11. Chromosome number 11. Let me draw a normoblast. It is a normoblast, the precursor of the RBC. Either it is early, intermediate, late, pro-normoblast or hematopoietic stem cell. They have nucleus. Let me draw a nucleus. Inside the nucleus, we all have 46 chromosomes, right? 46 chromosomes, or can I say 23 pairs of chromosome? 23 pairs. Okay, let me draw pair number 1, pair number 2, pair number 3, pair number 4, pair number 5. Likewise, we have 23 pairs. I'm not interested in all pairs. I'm interested in pair number 11. Let me draw again pair number 11. So this is pair number 11. Pair number 11. Pair number 11 inside the normoblast. This is a time you should understand कि cell क्या है. Cell के अंदर chromosome number 11 के ऊपर we have a gene. The name of this gene is beta globin gene. This gene synthesizes beta globin. This gene synthesizes beta globin. Give me a thumbs up. Give me a thumbs up. So this is a gene, not only small, this big. This portion is the gene. This portion is the gene, beta globin gene. Everyone give me a thumbs up. Now it will synthesize mRNA now. From DNA first mRNA is formed, from mRNA protein is formed. So transcription and translation takes place, right? So there is a mutation here. The mutation, so on the DNA we have codons. A triplet of nucleotide is a codon. So the sixth codon is mutated. The sixth codon. Let me show you the diagram now. So can you see this is DNA? Everyone see normal. Everyone first see normal. Then I will tell you sickle cell anemia, the mutation. First see normal. Normal में DNA में this is the sequence. This is the sequence. This is the sixth codon. This is the sixth codon in DNA. DNA. So DNA is normal. So DNA में से normal mRNA is formed. Normal mRNA में से normal amino acid is formed. So at the sixth number we have glutamine. At the I am having glutamine in my pronormoblast, in my all normal. You are also having glutamine. So glutamine, this is forming normal beta globulin. This is, but if the mutation occurs at the sixth position in DNA, instead of CTC, it is CAC. CTC की जगह हो गया CAC. So mRNA में GAG की जगह हो गया GUG. Right? So glutamine की जगह हो गया valine. So the summary is that instead of glutamine, we have valine at the sixth amino acid. So sixth amino acid of the beta. This is not alpha. It is beta globin. It is beta globulin. Beta globin. So hemoglobin में beta globin में sixth amino acid में glutamine की जगह valine आ गया. So you will say मैम उसकी वजह से क्या हुआ? एक amino acid is changing. Now out of the 100, we have amino acid number 1, 2, 3, 4, 5, 6, 7, 8 till we have many amino acid in the beta globin. Only the sixth one is changed. Normally we have glutamine, but instead of glutamine there is valine because there is point mutation in the DNA. Instead of thymidine we have adenine. T की जगह A हुआ DNA में, T की जगह A हुआ. So उसकी वजह से glutamine की जगह valine आ गया. So उसकी वजह से क्या हुआ? What does it happen? So normal, this is the RBC, and in the cytoplasm we have hemoglobin. Hemoglobin में globin है, right? Here, so globin is normal, but here globin will polymerize. The globin is abnormal, na? So it will polymerize. Because of polymerization, the shape of the RBC will become sickle shape. This is the reason why the RBC becomes sickle shape. So here normal RBC is biconcave shape, but now it becomes sickle shape. Why? Because inside both of these RBCs, we have hemoglobin. Inside the hemoglobin, we have globin. I'm not interested in heme. I'm interested in globin. Globin is also of two types, alpha and beta. So I'm interested in beta. Beta globin is defective. Here alpha is also normal, beta is also normal. Heme is also normal. Here heme is normal, alpha is normal, but beta is defective. What is the defect? In beta, at the sixth position, instead of glutamic acid, we have valine. Because instead of thymidine, there is adenine in the DNA. So if someone is asking you what is the defect at DNA level, tell me the defect at DNA level, tell me the defect at globin level. So at DNA, your answer, instead of thymidine, we have adenine. At globin level, instead of glutamic acid, we have valine. उसकी वजह से हो क्या रहा है? The shape in RBC, what is the defect in RBC? इसकी वजह से RBC में क्या हुआ? The shape of the RBC, instead of biconcave, it becomes sickle shape. So I cannot simplify more than this. These are the heights. These are the limits. I have simplified. So examiner can ask you any question. What is the defect in DNA? This is the answer. What is the defect in globin? Because of this, what is the defect in globin? So thymidine tha, so it was coding for glutamic acid. But adenine is coding for valine now. So instead of glutamic acid, we have valine. You have inverse option also. Valine की जगह glutamic acid नहीं है. Glutamic acid की जगह valine है. So valine is replacing glutamic acid. Not glutamic acid is replacing valine. Normal is glutamic acid. And now in sickle cell anemia, we have valine. So what will happen in RBC? RBC shape will change. Instead of biconcave, there is sickle shape. So you will say कि ma'am, शेप चेंज हो गया तो उससे मुझे क्या फर्क पड़ता है? नाउ इनसाइड माय ब्लड, आई डोंट टेक एवरी डे माय आरबीसी आउट एंड सी व्हाट इज द शेप ऑफ माय आरबीसी. नाउ इंस्टेड दे आर बाइकॉन्केव इनसाइड माय ब्लड, or instead they are sickle inside my blood vessel. How does it matter to me being a human being? How does it matter? What is the shape? Even if you ask a layman what is the shape of your RBC, layman don't know. I don't know what is the shape of my RBC. How does it matter for me? Whether they are square, whether they are triangle, whether they are circle, how does it matter to me? How does the patient will have clinical symptoms because of this change in shape? How does it matter for a patient, for a human being? So let me draw two blood vessels. This is a blood vessel, this is a blood vessel. If RBCs are biconcave in shape, they easily pass from the blood vessel. Easily. It is a capillary, small blood vessel. But if they are sickle shaped, they got stuck. They will get stuck and they will obstruct the capillary. They got stuck. They cannot move ahead. They got stuck and they will obstruct the lumen of a capillary. They will do the obstruction. Now both of these capillaries are supplying some organ. This is an organ, this is an organ. They are supplying some organ. So here blood flow is always there in the organ. But here this organ is not getting the blood flow. That's why this organ will have ischemia. So ischemia is a result in sickle cell anemia. That's why the child was having severe pain in the abdomen and non-healing ulcer. Now you got the symptoms. Now because the ulcer, we all have ulcer some or other day. मुझे यहाँ पे ulcer हो गया, but my ulcer will heal. After 2-3 days it will heal because it is getting the blood supply, so it will heal. But if I'm having an ulcer anywhere in the body and my ulcer is not healing, means this area is not getting the blood supply, right? Or any organ, this child will have severe pain in the bone, severe pain in multiple organ. This is known as crisis. So crisis is not always there. Now RBCs are not permanently sickle shape, that you have to understand. This child normally have biconcave RBC, but during deoxygenated state RBC will convert into sickle shape. So RBC change in shape, vice versa, both are possible. So when shape is biconcave, this child will not have any symptom, the child is normal. But when RBC convert into sickle shape, the child will have symptoms. Symptoms में severe pain in multiple organs, especially bone, abdomen, intestine, ये सब में necrosis, ischemia. The pain is due to ischemia, number one. And ulcers will not heal. So these are the symptoms. This is known as the patient is in crisis. So again and again, the patient in crisis, patient will become normal. Patient is in crisis, patient is in normal. So when sickling takes place, patient is in crisis. I hope you got it. I hope. If you have any doubt, please ask. Yeah, lethargy and all the things will be there, of course. So have you see? So can you see here in the DNA, what is the defect? So normally we have adenine, but now we have thymidine. Yeah, here instead of adenine, we have thymidine. So in RNA, normally we have adenine, but now you have uracil. But at protein level, if you ask, at protein level, normally we have glutamine, but these patients have valine. So you should know defect at all level. You should know. Now count the number of codon. So this is DNA. Codon 1, 2, 3, 4, 5, 6. Sixth codon is mutated. So in mRNA also, it is the sixth amino acid, which is glutamine. Instead of it, it is valine. So it is the sixth number. So question can come on anything, right? Question can come on anything. So this is normal hemoglobin. It is not polymerizing. So the shape is biconcave. The shape is biconcave. But here the hemoglobin will polymerize. That's why the shape of RBC changes from biconcave to sickle. See yourself, see how the polymerization takes place. Everyone can now see this is a blood capillary. The blood capillary, the circular RBCs, the biconcave, they are easily passing. They are easily passing. They are not getting obstructed. But this is a capillary. See the second diagram. The sickle cell RBCs, if you can see, they are stucking and they are causing the obstruction. Because of this obstruction, the patient will have sickling. The patient will have sickling. I'm not reading the whole thing. You read it by yourself. I can provide you the PPT, right? So the symptoms are due to vaso-occlusion. The symptoms are due to vaso-occlusion. That is ischemia symptoms. That is ischemia symptoms are there. You got this point? Yes or no? Say yes or no. So that is the thing. That is the thing. Yes. So patient have two problems. Number one, anemia. Due to anemia, patient have lethargy. Someone was saying lethargy, no? Lethargy is due to anemia. And patient have pain. Pain in multiple organs, the bones. That is due to vaso-occlusive phenomenon. That is due to ischemia. Everyone. So pain is in the bone, especially hand-foot syndrome. Patient have ischemia of the end bones. So the digits, the fingers of the hand and the fingers and toes of the foot, they got ischemia very soon. So it is known as hand foot syndrome, right? So multiple patient have vertebra will become fish mouth because of the expansion, because of the occlusion of the vertebral artery occlude ho jayegi to vertebra will become fish mouth. I will show you the diagram. Can you see? This is hand foot. The child have severe pain in the bones of the hand and the foot. So all the organs can undergo ischemia. All the organs. In the end, the spleen will undergo autosplenectomy. The spleen will undergo autosplenectomy. That is also a feature. So these all features are known as aplastic crisis. Everyone give me a thumbs up. Everyone. One more question. Few more questions on sickle cell की बात चली ही है तो few more questions. Few more questions. Okay. I will read the question. It is not a 4-option MCQ. It is a simple question. Let me ask the question. You write your answer in the chat box then. After developing dehydration, patient was normal, but after developing dehydration, after diarrhea, a 9-year-old boy was there. Imagine a 9-year-old girl is there. A 9-year-old Bengalese girl, right? Bengalese girl was there. She was a child and she was having diarrhea. Diarrhea is very common in child. It's okay. The child got dehydrated. It's okay. What is the problem in that? After that, child suddenly develops severe extremity pain because of diarrhea, after diarrhea. So the mother carries the child to you. Doctor, she is my child. She is my girl. And after dehydration, she was absolutely normal till yesterday. Yesterday she got diarrhea, but I had given the ORS, I had given the antibiotic. But okay, the diarrhea is okay. But now she is having severe extremity pain, the bony pain, the pain in the hands and the foot. And she is having moderately enlarged spleen. You have palpated the spleen. The spleen is enlarged in the child. You have tested CBC. In the CBC, hemoglobin is 6. Hemoglobin, she is severe anemic. She is severe anemic. And the peripheral smear is given to you. Peripheral smear is given to you. Now, 3 questions I would like to ask one by one. What is your diagnosis? Number 1. What is the hemoglobin electrophoresis in this patient will show? Number 2. Why does the child is having extremity pain? Number 3. And what biliary tract complication this child can occur? Number 4. So 4 questions, 4 answers. Yes. So Moksha, you are right. Yes, you all are right. The first question, the diagnosis of sickle cell anemia. I'm sorry. You all can see the image. See the sickle cells. See the sickle cells in the image. Please everyone appreciate the sickle cells in the image. Everyone appreciate the sickle cells. So the diagnosis is straightforward. It is a sickle cell anemia. Now, why the child is developing symptoms only after dehydration? Initially, the child was normal. Dehydration precipitates sickling. Dehydration. Initially, all the RBCs were biconcave, but because of dehydration, it precipitates sickling. There are many risk factors for sickling. So dehydration ki wajah se it is precipitated, sickling is precipitated. So that is the reason. What is the hemoglobin electrophoresis? Instead of hemoglobin A, this patient will have hemoglobin S. Hemoglobin S. Now here, now compare the two things, thalassemia and sickle cell anemia. Both have problem in the globin. Both have problem in the globin. Globin. यहाँ पे अल्फा और बीटा दोनों हो सकता है. यहाँ पे problem only with beta, never with alpha. Both have problem with globin. But what is the problem? Here in thalassemia, alpha and beta globin are less. They are less or they are absent. So that is known as quantitative. Quantity is defective. Quantitative defect. Quantity is less. But here, beta globin it is not less. It is normal. जितना होना चाहिए उतना है. But whatever is formed, it is defective. It is defective. It is not normal. So instead of glutamic acid, it is having valine. So the quality is defective. So it is known as qualitative defect. Both these disorders are known as globinopathies. Globinopathies. Have you got it? So if examiner is asking you, tell me a quantitative globinopathy, the answer is thalassemia. And tell me a qualitative globinopathy, the answer is sickle cell anemia. Thalassemia can be alpha and beta both, but sickle cell anemia में only beta में change है, alpha में कोई change नहीं है. I cannot simplify than this. Everyone appreciate my efforts. At least appreciate my efforts. Have you got it? So the answer here is sickle cell anemia. The hemoglobin which is formed here is hemoglobin S. So what is the normal difference between hemoglobin A and hemoglobin S, you should ask. I'm having hemoglobin A. I'm not a patient with sickle cell anemia, so I'm having hemoglobin A. So in my hemoglobin, 2 alpha chains are there, 2 beta chains are there, right? But in a patient with sickle cell anemia, alpha chains are normal, but beta chains are defective wale. I'm writing S. The 2 beta chains are there, but they are defective. They are defective because what is the defect in them? The defect is instead of glutamic acid, they have valine at the 6th position. This is the defect. And here glutamic acid is present. Valine is not present at the 6th position. So that is the thing. So a hemoglobin with 2 alpha and 2 normal beta, it is hemoglobin A. And a hemoglobin with 2 alpha and a defective beta. What is the defect? At the 6th position, instead of glutamic acid, it is valine. So this is a defective beta. Such hemoglobin is hemoglobin S. So if you check the hemoglobin of a patient with sickle cell anemia, you will get hemoglobin S along with A. It is not 100%, maybe some percent. A to hoga hi, saath mein S bhi hoga. But in a normal person, you will get only A, not S. Give me a thumbs up. Give me a thumbs up. So you will get hemoglobin S. That is 2 alpha and 2 defective beta. 2 defective. So these patients will have more than 90% of the hemoglobin is hemoglobin S. The patient is in crisis. The crisis that is showing vaso-occlusive, and that is causing ischemia, that is causing pain. So the reason for the severe pain is ischemia in the bone because of the vaso-occlusion. Give me a thumbs up. Everyone give me a thumbs up. Now what will happen to these RBC? That you should ask me. Ma'am, what will happen to these RBCs? All these RBCs, what will happen to them? So they will get hemolyzed. They will get destroyed by the spleen. So this is the spleen of this child. Spleen. So all these RBCs will go in the spleen. Spleen will detect that it is an abnormal RBC. It is not normal. So I should destroy it. So spleen will destroy all these RBCs which are sickle shaped. That's why spleen enlarge in size. Spleen enlarge in size. It is doing more work. That's why first it enlarge and after बहुत काम कर करके it will contract. So first splenomegaly is there and after that spleen will shrink. So both phases are there in a patient with sickle cell anemia. Okay. So if these RBCs are destroyed, what will happen? You tell me. After RBC will get destroyed, the hemoglobin will come in the blood. From all the RBCs, heme and globin both will come in the blood. It will released in the blood. Heme will get converted into bilirubin. It will convert into bilirubin and this bilirubin will go in the gallbladder and form stones there. So these patients have high probability of forming gallbladder stones. Gallbladder stones, that is the pigment stones. These stones are made up of bilirubin. The pigment is forming. Why they have more bilirubin? They have more bilirubin because they have more heme. Why they have more heme? Because more RBCs are destroyed. So everything have a reason. So which biliary tract complication these persons will have? They have pigment stones. They have pigment stones in the biliary tract. Everyone give me a thumbs up. I tried it. One more question on sickle cell anemia. Read the question. You yourself tell me the answer now. No need explanation. No need of any explanation in this question, I guess. I have explained you everything. Read the question. 2 findings. One X-ray is given to you and one peripheral smear is given to you. 2 images are given to you for solving this question. See both images, combine them and tell me the answer. Which will be the patient with following peripheral smear and X-ray? So see the abnormality in the peripheral smear. See the abnormality in the X-ray. Let me show you peripheral smear first. In the peripheral smear, see this RBC. Okay. See this one. Okay. See this one. See this one. So your eyes should be vigilant to pick them. All the RBCs will not be sickle. It is few RBCs in the image will be sickle. So you cannot superficially see ma'am image to normal hai. No, few RBCs are sickle shaped along with target cells. I can see few target cells also. But target cell is non-specific. So of course, in the peripheral smear, my diagnosis is sickle cell anemia. What is the X-ray given? X-rays of vertebra. Now see the shape of the vertebra. This is 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 vertebral column ka X-ray here. The shape of the vertebra is fish shaped vertebra. Combine both findings. X-ray पे fish-shaped vertebra and peripheral smear पे sickle cells are there. So answer is sickle cell anemia. The diagnosis is straightforward. It is a simple case of sickle cell anemia. So what will happen in this patient? Does this patient will have hand-foot syndrome? Will it have black urine? Will it have elevated heptoglobin? Will it have splenomegaly with gallstones? What will happen? What will happen? Okay, two answers are correct. I may go. So the most correct answer is hand-foot syndrome. The patient is in crisis. Yeah, I agree. Splenomegaly with gallstones be correct. So A and D, I can say both are correct. Right. But here, hand-foot syndrome, what is hand-foot syndrome? The patient is in crisis. And during crisis, the patient has severe pain. So the X-ray shows fish-shaped vertebra. Why the vertebra become fish-shaped? What is the reason? Because the vertebral artery is obstructed by these sickle cells. These RBCs are obstructing the vertebral artery. So vertebra become fish-shaped. Everyone give me a thumbs up. One more question. One more question on sickle cell. You can't imagine sickle cell पे कितने questions आते हैं. One more. I will read it for you. Don't worry. So a 10-year-old boy, black girl, not boy, girl, 10-year-old girl brought to the emergency room. She complains of severe pain in the chest also, abdomen also, bones also. So imagine you are a resident in a hospital and at 2 a.m. in night, the parents are coming to you carrying a 10-year-old girl that there is an emergency doctor. So you will say, what is the emergency? Why you are coming at midnight to me? What is the emergency? You are at your emergency duty. They are saying my girl is having severe pain. So where is the pain? At what organ you are having the pain? She is having pain at the chest, abdomen and bone. It is unbearable. The child is crying, shouting that I am having severe pain. I cannot bear it. Right. Physical examination, you see she is yellow. She is yellow everywhere. She is having jaundice. And you have done a CBC. She is anemic also. She is anemic also, right? Not on CBC. You have seen the conjunctiva. The conjunctiva is pale, right? You have seen the conjunctiva. You have seen the sclera. So in the eyes, the sclera is yellow. That is showing jaundice. And the conjunctiva is pale. That is showing anemia. So in the eyes, both things will be visible, jaundice and anemia. One is sclera, one is conjunctiva, right? Her parents, you have asked the history from the parents. So parents is saying that she is anemic since birth. Since birth only, she is very lethargic and she is anemic, right? You have done a CBC. CBC is showing normocytic anemia. It is not microcytic. It is not microcytic anemia. It is not iron deficiency anemia, which is the most common anemia in children. But it is not microcytic anemia. It is normocytic with poikilocytosis. You have done a peripheral blood smear. It is given to you. And you have done a hemoglobin electrophoresis. It is showing hemoglobin S. So looking at the peripheral smear, all the cells are sickle cell. All the cells are sickle cell. Most of the cells are sickle cell. So the diagnosis is clear, and based on electrophoresis also, the hemoglobin S gives you the diagnosis. So this child is having sickle cell anemia. What the examiner is asking, what is the reason for pain? What is the reason for chest pain, abdomen pain and bone pain? What is the reason? Is it amyloidosis? Is it coagulopathy? Is it infection? Is it ischemia? Is it vasculitis? What is the reason for the pain? So all of you are right. Yes, the reason for the pain is ischemia. It is known as vaso-occlusive phenomenon. Vaso-occlusive phenomenon, which is very common in these child. So these child do not have pain always, but whenever they go in crisis, by crisis I mean the RBC change in shape. जब जब deoxygenated state होगा, तब तब RBC will convert from biconcave to sickle and they will cause the occlusion and the child is in crisis. Child will present with severe pain. So it is like the attacks of asthma. The patient have attack, the patient become normal. The patient have attack, the patient have normal. So in between the two attacks, the patient is normal. In the same way, these child have two crisis and between the period, the child is normal. So just suppose in this month child have one crisis episode, the next month child again have crisis episode. So we will give a list to the parents that take care of these factors. If you avoid these factors, the child will not go in crisis. So the risk factors for the crisis, I will ask the parents to avoid dehydration. I will ask the parents many other things, what the things you don't have to give your child to eat. So we will try to avoid the crisis. We will try to avoid it as much as possible. Give me a thumbs up. So these all cells are sickle cells. If you can appreciate, these cells are sickle cells. So we have, so answer here is ischemia. I want thumbs up from everyone. Do you have any doubt till now? So till now, we have done many questions. We have done questions on megaloblastic anemia, image-based questions. We have done questions on sickle cell anemia. What other anemia we have done? One more anemia we have done now. We have done few questions on thalassemia. Still many anemias are remaining. It is not complete. It is not complete. Still, the next question is on hereditary spherocytosis. The next question is on, G6PD deficiency. Many hemolytic anemias are remaining. Iron deficiency anemia, aplastic anemia, in sub image-based questions are very common. Very, very, very common, right? So, but the time is limited. I have to stop the lecture. Unfortunately, even if I don't wish, I have to do so. So let me announce my next lecture, then you people can go. Have you enjoyed the lecture? Have you learned? Have you learned something in this lecture? If yes, please write down in the comment box. Please give a comment. Please write down in the comment box that you have learned in this lecture. So thank you very much for being with me. I really enjoyed teaching you. Hopefully same from your side also. Just a second. So thank you very much for being with me. I forgot to put the slides. You have to give me a minute. Just a second. Just a second. Give me a minute. Okay, I'm not finding it. Just so there are few announcements for you. Can you see my screen? Yes, you can see. Yeah, you can see. I'm sorry. So this is the calendar for week 2 April free test. At Unacademy, we conduct free test every week. So this is the calendar of this week. I recommend all the students to give the test so you can know what are your mistakes, where you are standing. So you should participate in the test. The test is absolutely free. You require a code to participate in the test. You can use my code Sachdev10 to participate in all these tests, right? On NEET PG 2022, All India mock test is going to happen on 17th April at 9 a.m. in the morning. Please set reminders. Mark the date and set the reminders. You all have to participate in this All India mock test and you have to see what is your rank. What is your rank? Unacademy Lite is already out. That is the test series which Unacademy have launched. We have launched MBBS Prof 1 for the preparation of MBBS University exam and next. The plans are available in front of you. So anyone from MBBS First Prof or your juniors are there, you can inform them. They can take this subscription. It is exclusively for First Prof students. We will cover anatomy, physiology and biochemistry for the university exams as well as for next preparation in these plans, right? After that, these are the offers till, okay, April 6th is already there. Okay, you know already two types of subscriptions on Unacademy. One is Plus, in which you will get access only to code Sachdev10. Before payment, you will get straightforward 10% discount. So the code is SACHDEV Sachdev10. So when is my next class? When is my next class? My next class is today after 1 hour at 11 a.m. Where? It is not on YouTube. It is on Unacademy app. It is on Unacademy app. So those who use Unacademy app, they already know how to use it. For the newcomers, please go to the Play Store. From the Play Store, install Unacademy Learners app. After installing Unacademy Learners app, choose the NEET PG category as a goal. NEET PG category as a goal. After that, at 11 a.m., you will get a free class. The class is free, like YouTube only. It is a free class. It is a special class. So click on the link. It is my class. My name is Dr. Priyanka Sachdev, and what I'm going to teach you at 11 a.m. today after 1 hour, I'm going to continue image-based question. What topic? I'm starting systemic pathology, that is cardiovascular system. Ke all image-based question in that class. So don't dare to miss that class. For the newcomers, you will require a code. The class is free, but for joining the class, you will require a code. The code is Sachdev10. SACHDEV Sachdev10. Distribute this code to all the medicos in your contact throughout the globe. And please ask everyone, those who are interested for any medical entrance exam, please join the class. I am going to discuss very important image-based question from cardiovascular system. What about leukemias and lymphomas? Tomorrow at 9 a.m. on YouTube, I will discuss image-based questions of leukemias and lymphomas. But today, at 11 a.m. I'm going to discuss CVS. So I want all the students to participate in this free class. All the students. Very important image-based question I'm going to discuss from Robbins. So you can't afford missing it. The class is absolutely free. Everyone can join it. Only thing you require a code to join it. The code is Sachdev10. Note down the code. It is Sachdev10. The class is free. Note down the code to join it. It is not on YouTube. It is on an Unacademy app. Unacademy Learners app you have to install. At 11 a.m. you go to the app. You will see my free class. Click on the link. Give the code, you will join the class. So thank you very much for being with me. I really enjoyed teaching you and I'm ending this class now. See you all at 11 a.m. after 1 hour. Right? Have your breakfast, have a cup of tea, coffee, refresh yourself. Come back. We will again continue.